Hello, my name is Dr. Georgia Phillip and I work at the Centre for Research on Children and Families in the School of Social Work at the University of East Anglia. I've worked on two major Nuffield funded projects on fathers' experiences of child protection services and of family justice. The project I'll talk about today was a study of fathers and repeat or recurrent care proceedings running from 2017 to 2020 and entitled Up Against It. This project was a collaboration between UEA and Lancaster University, led by Professors Marion Brandham and Karen Broadhurst. I was the project manager and a lead researcher on the qualitative longitudinal study, which formed one of three strands of the project. Up Against It is the first investigation of fathers and recurrence and builds the evidence base alongside the important research about mothers. So in what follows, I will briefly give an overview of the different strands of the project and present some overall findings and the practice or policy messages that arise. And as part of this, I will share some key themes from the qualitative work that provide powerful and pertinent insight into the experiences of recurrent fathers. Our study was a mixed methods project involving 20 local authorities and 8 voluntary organisations from a wide geographic spread across England. The first strand provides a population-level picture of fathers in first and repeat care proceedings. We undertook statistical analysis of administrative data held by CAFCAS on all formal cases of care proceedings brought by local authorities in England between 2010-11 and 2017-18. So for the first time, we were able to look at patterns and trends for fathers in first and repeat proceedings in comparison with mothers. Key elements of this were not just the numbers of fathers and the rate or risk of recurrence, but also an analysis of how or with whom fathers and mothers returned to court. The second strand of the project consisted of a survey of fathers involved in first and repeat care proceedings across 18 local authorities. This comprised of a 2-part paper-based questionnaire, 1 part completed by the father and 1 by a practitioner involved in the case, and the number of completed questionnaires was 127. And this survey produced a first indicative picture of characteristics and circumstances relating particularly to recurrent fathers. The third strand consisted of a qualitative longitudinal or QL study of 26 men's experiences of recurrent child loss. This involved 2 in-depth interviews at the start and end of the study period with monthly phone calls over a period of 12 months. The QL study covered all aspects of the men's lives and histories, relationships, and their encounters with services. And the QL study added real value in following men's lives over time, to gain important and much needed insight and to map change and also a sense of factors related to that change. And lastly, we formed a learning network with participating organisations and held focus groups with practitioners. And this was to sense check early findings and also to share practice experiences. The points over the next 2 slides are drawn from the analysis of the court data and from the survey. We found an increase in overall numbers of care proceeding cases over the 7-year time period, with parallel trends for fathers and mothers. There are consistently more mothers than fathers appearing, and a gender gap that's not closing. However, while there are missing fathers in care proceedings, and so cases where mothers appear alone with no father recorded, in 80% of cases the father was known and named as a party to those proceedings. And we suggest that this means there is work to do to address both the 20% of missing fathers, but also to fully and fairly engage with the visible 80%. And we have to remember that the court data does not tell us anything about engagement. Fathers had a much lower rate of entering subsequent or repeat care proceedings than mothers, nearly half that of mothers. After 5 years, we see that 22% of mothers had returned, while for fathers we see 12%. But nonetheless, this means that significant numbers of fathers return to court. Of the fathers who do return to court, an important finding was that 3 out of 4, or 79%, do so with the same partner. Recurrent couples, recurrent families are a real part of the picture, particularly for men. And we suggest there is a need to reframe certain stereotypes about fathers, such as fecklessness or absence, and there is also a need to work with couples. We also looked at factors affecting the likelihood of recurrence for fathers. Parents' age and the age of the child at first proceedings are factors affecting recurrence. Younger parents and parents of younger children are more at risk of returning. And this means that it's vital to recognise that the removal of babies into care impacts on fathers too. We also identified other factors that were significant to recurrence for fathers. So, compared with fathers with a single appearance in care proceedings, recurrent fathers were more likely to have been looked after as a child, to have experienced multiple or complex childhood adversities, to be unemployed, and to be not living with their youngest child. So our findings suggest an association between what we might see as cumulative and complex adversity and father's appearance in repeat care proceedings, but this is not a straightforward or causal link. The next findings relate predominantly to the qualitative longitudinal study, but they're also supported by the survey data. Following these fathers' lives over time demonstrated a clear need for bespoke and longer-term support for men when children are removed from their care, to mitigate harmful coping strategies which further exclude them from being seen as suitable fathers or partners in the future, or from reclaiming fatherhood with existing children. Our study showed that the pattern of recurrent fathers with unresolved childhood trauma that absolutely blights capacity for emotional regulation, nurturing relationships and family functioning was hugely notable, and there is an urgent need for services to engage with this. There are powerful examples of highly skilled, sensitive and strengths-based work being developed for mothers, but there simply is not the equivalent service response for fathers. Fathers and couples need resources and support to manage emotions and relationships differently. And without this, couple conflict or worse, abusive behaviour and its impact on parents remains a key factor in families becoming stuck in a cycle of recurrence. The next few slides will present 3 significant themes from the qualitative study, and I urge you to consider and reflect on these alongside the other findings and alongside the final messages that I'll present in a few minutes. I want to say a few things about the sample of fathers who took part in our qualitative study to give some context to the qualitative findings I'm going to share. It's interesting to note that in a number of ways they mirror many of the characteristics of samples of mothers who've experienced repeat care proceedings. Fathers and mothers experiencing repeat care proceedings appear to be up against multiple and complex challenges, often arising in childhood and then accumulating into their adult lives. The majority of fathers in the QL study and also the survey were white British, and this pattern is one of the similarities with studies of recurrent mothers. There are vulnerabilities and forms of marginalisation facing economically, educationally and health disadvantaged white men, but this characteristic also raises the question of inclusivity and ethnicity for researchers and practitioners alike. So we ask, how can research studies and services more effectively reach and engage with a wider range of communities? Fathers in the QL study illustrated the factors we previously identified as affecting the likelihood of repeat care proceedings. Over half had experienced serious and multiple childhood adversities, including being in out-of-home care, were unemployed, were living in social housing, and were not living with their youngest child. It's also important to note the complexity and the dynamic nature of men's relationships and contact with their children. Almost all had some contact with children they didn't live with. Only a minority had no contact with any child. And this again points to the need to both understand fathers' relationship histories and to challenge certain assumptions of absence or non-involvement that can be quick to take root. The father's experiences of health adversities and adverse coping strategies was also notable. Chronic and multiple physical and mental health issues were notable, including diagnosed learning disability or autistic spectrum conditions. Over half of the fathers had some history of substance misuse, particularly with alcohol and cannabis use being common, and offending, often in their earlier lives or adolescence. 7 fathers had been cautioned or charged with a domestic violence offence, but none had been imprisoned for violence against their partners. In terms of child welfare concerns, there were some perhaps unsurprising issues. Most common were child neglect, substance misuse, domestic abuse, poor mental health and learning disability, and there were some hugely poignant histories of couples with learning disability who had lost more than one child to care. So the first theme I want to present is about relationships. It's not unusual to highlight the significance of relationships as both protective and risk factors, but we argue that a full and fair understanding of men's experiences and histories of relationships across their whole lives is often missing or very limited. For fathers at risk of first or repeat care proceedings, building the fullest picture of relationships, but also their relational resources, is crucial. For these fathers, childhood relationships were characterised by maltreatment, primarily in relation to physical, sexual or emotional abuse arising from their immediate familial network. And this was often compounded by other forms of loss or instability or disruption, such as bereavement, precarious housing, parental mental ill health, educational exclusion, and so on. Another notable finding was that in their intimate partner relationships, over a third of the fathers in our QL study were in long-standing relationships. Now, these often included periods of separation, but it was notable that couples had been through repeat episodes of child protection and care proceedings together. These enduring relationships were often fraught with recurring or codependent difficulties that often exacerbated problems and escalated professional concerns. But nonetheless, those relationships were important to recognise. The second theme is about the emotional impact of repeat care proceedings for men. The findings here are comparable with the experiences of mothers, though there are gender differences in terms of how emotional pain is expressed or defended against, but also how it's interpreted and responded to by professionals. Painful emotions are not static. They overlap, they ebb and flow, they subside and intensify in different contexts and over time. And this is really important to consider in relation to interventions and service design and implementation. Some fathers experienced an incremental emotional shutdown, and this was damaging to their own mental health and to their relationships, including those with professionals. Other fathers actively resisted shame using forms of bravado or fighting for their children as a means of defending their moral and paternal identity. And we saw that this often did not play well for them and could also further isolate or exclude them. We suggest also the idea of bearable guilt that allowed some recurrent fathers to reconcile legal outcomes for children and also their part in what had led to these, and which in turn seemed to allow them to better retain some stake in fatherhood going forward. The third theme is about attempts to reclaim or hold on to aspects of fatherhood. It's important to recognise that most fathers in our QL study were attempting to make or sustain changes in their lives, but that the resources they had to do this were few and fragile. Almost all of the fathers were making some efforts to reclaim their sense of father identity and fathering activity to some or all of their children, though of course with varying degrees of confidence, capacity and success. And this is another way in which assumptions of father absence or non-involvement need to be challenged. Key factors that we observed as being associated with reclaiming fatherhood were some level of stabilisation or basic life security, such as in housing, a positive change in relationships with partners, or responding to an opportunity to reconnect with a child, for example, a request for contact from a child. Reclaiming fathers wanted to prove to themselves, to their children, to their partners and others, including professionals of course, that they could be reliable and credible parents. But we would emphasise that change was not linear. It was much more often messy, it was interrupted, it was stalled, it was fragile and it was hard won. So I want to just offer some final or concluding thoughts. Recurrent fathers are vulnerable. They may well pose risks arising from those vulnerabilities, but they should also be seen as at risk themselves. It can be argued that fathers are able to opt out of parenting in ways simply not available to mothers, but at the same time they are also more likely to be seen as optional and thereby be overlooked or marginalised. So fathers, like mothers in care proceedings, need both challenge and support. We also suggest that it's important to see fatherhood as generative and as a potential mechanism for behaviour change. Recognising this might offer important alternatives to deficit perspectives of fathers and fathering, and generative fathering, we suggest, forms an important potential point for service development. We also need to think more expansively about how fathers permanently separated from their children can be supported to retain some stake in fatherhood which benefits those children. And this is not exclusively about contact. It might include contributing to family or life histories, providing medical information, meeting identity needs for children, financial support, or offering restorative explanations or apologies. And I want to end with a simple but stark point. There is unmet need and a clear need for services to work proactively with fathers who've had children removed from their care or who are at risk of doing so. Thanks for listening.